Hey, and welcome to this special live episode of the Dental Guys, broadcasting live on Facebook, YouTube, for the Academy of Yasu Integration and the Dental Guys. I'm proud to bring you this live stream episode. John, welcome to the show. This is it. The special week has finally arrived, John. Tell us a little bit about it.
Yeah, we've been talking about this now. I mean, I would like to say it's just for weeks or months, but really it's been for a lot of years, Wes, because this has been the meeting that we have looked forward to literally every year since, for me, about 2008. And it's been our dream as Dental Guys podcast to be able to be more involved with this meeting. And here we are, Wes. We're just a few days away from being in San Diego live at the Academy of Yasu Integration annual meeting, being able to talk to some of the world's best and brightest in implant dentistry about what's going on. And, first of all, welcome back to in-person meetings, huh? How about that? I mean, now I know this is the one thing, right? I'm not wearing a mask currently. Now, in a few days, you won't know what type of facial hair Wes has. You won't know what type because we will probably be broadcasting with masks on, but that's okay because at very least, Wes, we can be in the room across the interview booth from some of the biggest names in implant dentistry. So, I mean, this is a long time coming, and to be able to overcome a couple of years of basically Zoom meetings. Now, again, there's value to that, as we've talked about. Wes, it's been a long time since Seattle we heard the news that AO was having to cancel the Seattle meeting. Here we are back, really better than ever.
Yeah, I'm super excited about this week. It's been since 2019 since we've been able to do a live Academy of Yasu Integration meeting. And let's talk a little bit about us, John. Lord, this is the Dental Guys podcast, and we have collaborated with the Academy of Yasu Integration to bring you this live stream this week from San Diego. We are in our home studios today. We'll be traveling out to the home base, the mothership that's being prepared for us there in San Diego. I'm super excited about that. John, I think about the back, when we really met each other. We met really at a special time in implant dentistry, and we got to travel over to like the home base of dental implants. Really, Sweden was where a lot of these things and concepts began. But before that, John, our involvement, that's where we met, but our involvement in dental implants started really in dental school. And it's interesting how our careers had this parallel path. And the Dental Guys both received this Student Dental Implant Award as seniors. John graduating from the University of Connecticut, me graduating from the University of West Virginia, or West Virginia University, and we're super excited to be a part of this special week for the Academy.
Yeah, and to have this all start though with the student, the Outstanding Student Implant Dentistry Award, which at the time, right, when you are a dental student, you really don't even understand what the Academy is. You get this award, they say, hey, we really think you're doing, awesome things and you're interested in implants. You've distinguished yourself. Both Wes and I get this award. We, didn't know each other. We're like, I don't really know what this is. All of a sudden, this journal starts showing up. This journal starts showing up in my mailbox, and I start reading this. And, my professors, Tom Taylor, was one of the big names that really influenced me in this world. And he said, you really need to go to the annual meeting. And I said, man, I don't have a lot of money. Long story short, made my first annual meeting, and it was out in Phoenix. This is years ago. And it totally changed my whole way of thinking about how dental meetings can be. And so then a couple years later, Wes and I, who practiced an hour from each other but had never met, ended up meeting in Sweden at, basically the headquarters of some of the oldest and best known, quote unquote, implant research that was ever done and implant companies. And so, fast forward to that was 2012. In 2015, we start podcasting. There was only probably my mom and Wes's mom listening for the first year or so. And then here we are, Wes, 7 years later, after being able to engage with, companies and researchers
Mm.
and some of the biggest names in dentistry and Frank Spear and Dennis Tarnow and some of these names.
Mm.
And here we are getting really to partner with the organization that truly, in a lot of ways, influence you and I
Mm.
to be the implant dentist that we are today because of challenging us in ways that we needed to be challenged. And we look, again, forward to this meeting. So here we are, Wes. Let's talk about the meeting. It's
Yeah.
coming up in a couple of
So
days.
there's so many things that are complex in dentistry today. And one of the things that the National Institute of Health established in 1988 is they established implant dentistry as its own kind of it's its own kind of specialty. It's a subset of dentistry that it's there's so many things surrounding it. There's a restorative component. There's a surgical component. And one of the things that really keeps us involved in the Academy of Osseointegration is that they have this idea that there's not really one component that's more important than another, right? This meeting is founded on really the idea of clinicians from the restorative side and the surgical side coming together. I think it's one thing that we've really enjoyed about the Academy because we can go there as wet finger dentists and come back with something for the surgical portion of a practice. We can also come back to help other surgeons out. And from a dental guy's standpoint, we can come back and really share with you guys these complex subjects and really, pare down what information. That's what we try to do at the end of the week is we try to have this recap show where we've really highlight the really what is the game changers this year, right, John?
Yeah,
I mean,
the takeaways.
Yeah, what's the takeaways? Why are we going to this meeting? What is it about dentistry right now, implant dentistry, that we have questions about, right? I mean,
and I think it's what's been burning, because as we look at this meeting and we look at some of the speakers, what is so interesting to me, just in the last, I don't know, couple of years. I mean, if you go back on our feed and you listen to some of the things we've talked about with implant dentistry, when we've been at the AO, we've had people get up on the podium just on this one topic of periimplantitis, for instance, which we're going to dive into just a little bit today. We have heard everything from periimplantitis is caused by bacteria. It's caused by poor hygiene. It's caused by implant surface technology. It's caused by the problems with manufacturing. It's caused by titanium that's coming out of implants because of poor connections and getting into the tissue. It's caused by not knowing how to properly cleanse the implant.
What about cement, John?
And it was caused by cement, right? Cementless in Seattle, right?
Oh, yeah.
And then it's also potentially could be caused by a acceptance versus rejection inflammatory reaction. And then maybe, just maybe, in the last few months, here we have some of the brightest minds, some of the most distinguished minds talking about that it could be just the advent of the rough surface implant. Oh my goodness. Do we even know what periimplantitis is?
Yeah.
And so this is why we go to this meeting, Wes. We go to this meeting to say, okay, these are things people take for granted, that you know what you know, but do you know? Do you really know why you are doing what you're doing in your practice? And Wes, just talk a little bit about, just because AO, what's different about AO, Wes? It's the difference between clinical opinion and what works in my hands, right?
Yes.
Versus what is validated. What does the science say?
What you're
and
talking
Wes,
about,
let's just
John,
talk about
is,
that. Why did we get? What is the difference between?
I think that's really
AO and other organizations?
I think that's really why we established the Dental Guys, right? Is to talk about the evidence that is published and not just opinion, right? And then, I think that the application of science into private practice or into the wet-fingered world, is like we like to talk about, is does this make practical sense to take what we've seen in this research project, right, this published journal article, and apply it to our day-in, day-out dental practice out in the real world? And I think that, whenever I run into articles that have been published in the Academy's journals over the years. There's two journals. We've got the International Journal of Periodontics and Restorative Dentistry, right? And we have the JOMI, which is an amazing journal of oral maxillofacial implants. And you take these journals, and some of these articles that have been publish a success rate for certain procedures. Like, for instance, to hit home with the periimplantitis is that I have a patient that's close to my life, okay, that had a diagnosis of severe periodontal disease, refractory, right? And reaching an end-stage dentition, John, right? If you go to the literature, right, this patient shows up to your practice and he's end-stage dentition. The teeth are gone. It's time to take the teeth out. And we do what the journals and what many years of research have led us to practice. And to be honest with you, the success rate of these procedures that we're doing, where we're taking people's teeth out, and whether it's we're putting single ones back or multiple teeth, like in this particular case, we are, banking on following protocols, following evidence, and then, right, you do have complications. And one of those complications that even I run into in my practice is this idea of periimplantitis and how it rears its ugly head. So, in this particular patient's mind, here we go at 5, we're tracking our bone levels at 1, 2, 3, 4, and 5 years. And then all of a sudden, right, you've seen it. If you've been doing implants for long enough, you've seen it. All of a sudden, you see maybe a rejection of the dental implant, but you see the dreaded Maybe. Black halo around the implant on the Panorex or the CT.
So what this brings us to say is, why does this happen? And if you go to, so what happens is you go to some meetings and you'll have some person get up and they'll say, well, this is why all periimplantitis happens, for instance. Yeah. And they will say, because this is what I do. So again, I'm going to bring this again home. One of our speakers at the AO meeting in just a couple of days, Torsten Jempt, if you know implant research, you know Torsten Jempt. He's been around forever. He's published some amazing stuff. And his last article in iJomi.
Hey, wait a minute. Just recently.
Right, just this month, right? Is talking about the fact that with specific surgeries to treat periimplantitis, in fact, not only was it not successful, it seemed to actually be worse when you treated it. So, here we have one of, again, the foremost, in terms of experience and time and publishing and data and research, and again, what do we have? For the same, at the end of this, the same conclusions, further discussions on what short and long-term clinical conditions should be expected in peri-implant tissue. So what am I saying here without diving into the high weeds? Do we really know? Here's Torsten Jempt saying, we're really not sure. This is the Brånemark Clinic, the oldest implant clinic in the world, and we still don't really know what's going on with peri-implantitis. So what's our goal, all right, for this meeting? Let's just bring this home, Wes. So what's one of our first interviewees? Hamle Wang. Yeah. Okay, on day one.
Bring it, right?
So day one, Hamle Wang is coming in to talk to us about periimplantitis, current understandings. This is why you go to these meetings, because reading the article is awesome, and you get a lot of good information, and you can apply it sometimes, and sometimes you can say what we do and what we don't know. But then you come to the meeting, and you have the researcher get up and say, okay, so I published this, I published this, I published this. And this guy published this and this. What does this mean for you on Monday morning in your practice? What should we take from this? What are the things we do and do not know? And a good researcher, a good clinician will be able to say, here's what we don't know. Right. And I am surprised in the last couple of years about the things that I thought that I knew that I really don't know that we know.
And there's some confounding mind things about periimplantitis, right? I mean, tomorrow on the show, we're going to be live again, and we're going to be discussing a great topic by Dennis Tarnow from IJPRD, a recent published article, right? This is why we belong to this organization, is because we're going to talk tomorrow about the fact that Dr. Tarnow believes that we need to reclassify how we describe soft tissue, right, around implants, right? And this idea of periimplantitis, right, John? I mean, I know we don't want to dive into the high weeds, but it's really hard to not say what a problem we have, because it seems like we've been talking about this, you and I, for too long, right? And everybody comes out with their special sauce reason, right?
Yep.
Of
and
why.
Everybody wants to equate it back. What I'm finding so interesting is there's this. So we talk about this, like people that have been doing this for 50 years versus 5.
Yes.
And there was an editorial published about this recently, talking about how, some of the strong opinions from the original Bronnemark group were saying that this was just the advent. We did not see this until rough surface implants came out. Now,
so
just
what
for
are
a
you
second,
saying, John? Wait a minute.
Just
now.
pause for a second, and you go, What are you talking about? Are you saying that everything was fine until rough surface implants came out?
Until we started placing implants, right, at the bone, like bone level implants, and we started like micro etching implants all the way up to the neck of the collar, right? Like in
right, and then you have Dennis Turnout coming back. And now Dennis Tarnow's coming back saying maybe we should have a polished collar at the top. This was someone who advocated the bone level and the rough surface and placing it subcrestal, and where does linga viscus fit in, and how does soft tissue even factor into this? What we're saying here is these are things that you may think you know, but do you really know? And are we truly seeing that what happened, like what you heard Chandra Wadhwani years ago saying, it was the advent of maybe new cements. It was the change from zinc oxide to new cements. Well, how much does that factor, right? We know there's some good data on that. Or how much is it the implant surface? Why was it that we didn't see this in 1975 and 1985? So this is where, again, this is why we go to the meetings. You have the 50 years of data who's actually people sitting on that stage who have been doing it for 50 years. And then you have somebody that represents an entire university worth of data. And then you have the clinician who may only be out for 5 years, who's presenting on some amazing cases or seeing trying some new things. And then everybody comes together and has coffee and figures it out and argues it out. And you know what else they're going to do, Wes? They're going to argue it out at the Dental Guys booth, at the exhibit hall with live streaming. Now, how beautiful is that? Let's get the best minds in there and let's get them to tell us what they really think.
I think the hard questions, right, need to be asked. And, it's hard to sit at home, right, over the last 2-3 years and be stagnant. And so
I've felt that sometimes, right? With not being able to really go to these meetings and do it.
Yeah, like you can't. You can read and look. I love journal articles, but you know what? My favorite time is, right? Is when John and I get to collaborate, right? And let me just say this is that one of my favorite routines that I got in when I was in residency was journal club night. And it was preparation probably a week or so in advance of picking out articles out of journals. And then, you know what that ended in? It ended in really sitting down. And I remember the resident director saying, "Hey, Wes, just tell me how this impacts my practice." And that collaboration, and then there's a point-counterpoint argument because you've got somebody that has so much wisdom sitting there across the table from you. And then you've got a young clinician here that just wants to drink knowledge, right? And P.I. Bronnemark said, surround yourself with people with greater minds than you are, and you're bound to succeed. And so without collaboration, right, this idea of just ingesting information is just not good enough. And this is why...
you have to have your ideas challenged, right?
That's right. If you're not challenging yourself... It's a problem. It's a problem, and you're not moving forward. So, John, let me just say this, is that if you're interested in knowing, right, about peri-implantitis, right, you can go to the journals right now and start doing the research yourself. Before you even go to the meetings, you can dive into that. You can become a member of the AO, which we love. We've been members for years. I just renewed my membership at the beginning of the year. And so you can do that, right? But what I challenge you is to lift somebody else up, right? Lift somebody up. If you're a specialist, listen to this, right? Then I think you need to grab your restoring doctors and you need to lift them up and raise them up and lift them up to learn something, right? If you go to the meeting, right? If you go to the meeting and you're live there with us, right? I think it would be your job, right? my challenge to you, I know John's challenge, I know what it is, right? It's to come back and like grab coffee with somebody and collaborate and teach them. Because listen, this is what it's about: collaboration, figuring it out, the tough questions we're going to ask, and we're going to do it on a big we have a big opportunity here. And we
Yeah,
want to
let's
thank
just
the AO
talk
for
about
that.
that.
Yeah, let's talk about
a little
it,
bit
John.
about
Yeah.
what should you expect from us and the AO in the coming days, besides the meeting, right? So we hope you're already on the way to the meeting. We hope that you already bought your hotel room 6 months ago. You were ready for this. You're like, San Diego, man, I'm ready. We're going to be on the USS Midway for the reception. It's utterly ridiculous in such a good way. AO always does it big. But in the unlikely event, and I'm very sorry for you, but in the unlikely event that you can't make it to the meeting,
registration is still open.
Right, exactly. If you have some
open.
lame excuse where you can't make it, so we are going to be at the meeting. We are going to be in the middle of the craziness at the exhibit hall, and we're going to be. We have kind of handpicked. I mean, all the speakers are great, but we have some pet projects, right?
Oh man,
Wes, that we are interested in specific topics, and so AO has graciously granted us the ability to have access to some speakers, and not only the access to the speakers, but to have a hashtag that's going to be cross-posted on their social media, our social media, where you can get on and say, hey, I see who you're interviewing. Mm-hmm. I want to ask this question to this person, whether you're at the meeting live or you're at home and you have some questions for some of the top minds. You can submit those questions via Twitter, Facebook. There's going to be ways to get that information to us. Now, I'm not saying we're going to ask all your questions. I'm saying that it's a possibility that your question could be asked. If you're live at the meeting, even better, because you can come and watch what's going on. You can see the sweat pouring down the faces of the opposing viewpoints. You can see the fingers. I'll never forget one of the times, the first meeting. Michael Norton was up, and he was the moderator at one of these. I remember at one of these corporate forums, and one of our, I won't even mention the name, but one of our biggest names in Astrotech, right at the time, that was the company for Densify, was talking about zirconia hybrids, and he gets up and he talks about zirconia hybrids, and somebody in the middle of his presentation stands up and says, "How many failures have you had?" And
right in the middle of the presentation, right in the middle,
and he was angry. He was angry.
Yeah.
And the speaker says, okay, well, we have had a few failures. Well, that's only meant for dental schools. We shouldn't be teaching this. We shouldn't be having this. Is marketing. And this is what's beautiful about AO, because we have the companies represented. We have the researchers represented. We have the clinicians in the middle trying to figure it out between the marketing, the companies, the clinicians. Everybody wants to push things forward, but we have to figure this out. There may be some controversy. We are encouraging a little controversy.
Listen, I guarantee you, right, that we're going to ruffle some feathers, right, in a good way, right?
In a good way.
And let me tell you where it all starts, right? So Thursday, February 24th, right, we go live, right? And at around noon, okay, Pacific time, okay, and if you're on the East Coast, that'll be about 3 o'clock your time, the dental guys will go live. And you can tune in, right? Subscribe via YouTube, Facebook. You can subscribe on the Academy of Osseointegration's Facebook or YouTube channel. You can go over to the Dental Guys and subscribe on the Facebook and YouTube channel. And one of the best ways you can do that is click the notification bell after you subscribe. That way you get notified that we're going live. Now, all these live episodes will live eternally, right? Unless we take them down because somebody did get in a fight, right? On the YouTube and on the Facebook, right? But listen, it is going to be amazing because this is the opportunity for us to be able to interview some of the best minds in the field and ask some of the unanswered questions that we've all been wanting to hear, maybe some solutions, right?
Yeah. And can we actually figure out periimplantitis once and for all?
I don't know, man.
Probably not.
Probably not.
But I hope we see some fireworks.
I just hope, right, that this is just the beginning of the future, right?
Yeah.
And one of the things that I would say is that it's never too late to sign up right now. I mean, you can go over to the AO's website, OSSEO.org, and you can go up to the top, professional development, and click on the annual meeting 2022. Better yet, you can go over and type in your web browser ao2022.osseo.org. Implant dentistry for all, John, right? Implant dentistry for all. Listen, it's the number one way that people are replacing teeth today. Dentists are replacing teeth with dental implants, and is the most successful restorative procedure. So if you want to learn how to treat your patients, right, with the most successful restorative procedure, we need you to, one, register, right? Because there's still room to move in. And number two, if you can't make it, no big deal, because we're going to be doing our AO recap show, but better yet, live at 3 o'clock,
Yep.
right? Eastern
And our
time,
plan
12 o'clock
in
Pacific.
the next couple of days.
Yes.
Yeah, in the next couple of days, our plan is to have that schedule out. We already have the schedule, but in order to, it's just to have that out on our
Now
social media outlets.
Put the pressure on.
So you can, well, I mean, our plan, right? We're going to see, we're working it because we already kind of know what we're doing, but we're trying not to blow all of our cover here on everything we're trying to do, because we want there to still be a little bit of, excitement, but we want you to know when to tune in, because we know you're going to be busy working at your office if you're not at the meeting. So we're thinking about ways you can jump in the middle of the day and see some of the highlights of the things you want to see. So stay tuned. Tomorrow night, we will be back. As Wes said, we'll be back talking more about some controversial things, some things we're looking for, some unanswered questions. As Wes said, unanswered questions that we're hoping to get some clarity on. So tomorrow night, join us back again around this same time for another preview of what's coming, a little bit more about maybe unveiling of some things we're going to be doing, some people we're going to be talking about and talking to. We want you to go ahead and get, as Wes said, like, subscribe, get ready, make sure notifications are coming through, make sure that you're involved with AO's social media, the Dental Guys social media. We are excited to bring this meeting to you in a way that we've been looking forward to for a couple of years, since in-person meetings kind of went away and now they're back and they're better than ever. So we're excited. Wes, it's time. We're ready. It's finally there. So now is the time to put this on your calendar. Make sure you don't miss it. Get on our social media. Make sure you are where you need to be so you don't miss a part of this. For Wes, I'm John. We are the Dental Guys.